morning students. Now I am going to tell about LSCS instruments and their purpose and procedure. What is the meaning of LSCS? LSCS is Lower Segment Caesarean Section. Why they are doing this one? If the patient is failed for normal delivery, if the patient is having CPD, or the patient is having obstructed labor or delayed second stage, that time they are performing the LSCS. Many reasons are there. Mostly the patient come with the CPD. CPD means cephalopelvic disproportion. Okay. Now I will explain the each instrument's name. This one, tooth forceps, non-tooth forceps, curved scissor, Alice forceps, curved artery, valsellum, green amputate, cocker, straight scissor, backhook, sponge holder, small bowl, outlet forceps, Doyne's retractor and kidney tray. These are all the instruments they are using for the LSCS. Some doctors, they are not using all the instruments. According to their practice, they are using some instruments only for the LSCS. But basically, these all the instruments we are keeping for the table setting. So now I will explain the each instrument purpose. Tooth forceps. Why we are using tooth forceps? After the skin incision, they are holding the skin. For that purpose, they are using tooth forceps. And one more purpose, when they are doing suturing, that time they are using the tooth forceps. Non-tooth forceps, when they want to hold the small blood vessels. For that time, they are using the non-tooth forceps. Curved scissor, why they are using? When they are cutting the small tissue or muscle or any dissection, that time they are using the curved scissor. Alice forceps, again they want to hold the thick skin or heavy muscle, that time they are using the Alice forceps. Curved artery, they are holding any blood vessels opening, small blood vessels opening, that time they are using the curved artery. One more purpose of the curved artery, we want to separate baby from the mother. So we want to clamp the umbilical cord. For that purpose also we can use the curved artery or straight artery. This one, valsellum, sometimes they are using to hold the uterus, sometimes they are not using valsellum to hold the uterus. Green amputate, this one, if the uterus is having heavy bleeding, to control the bleeding, to stop the bleeding, that time they are using the green amputate. This is the green amputate. This one, cocker. So curved artery and cocker, when you are seeing, is mostly same instrument only. What is the difference? Means curved artery, we don't have tooth inside, but in the cocker we can see tooth here. This is the difference between the cockers and curved artery. If tooth comes, that is the cocker. If it is the plain in the tip, that is the curved artery. So why they are using this one? If the bleeding is heavy from the uterus, if the blood vessel open, they want to hold, that time they are using the coccus. Some doctors, this coccus they are not using because the tooth tip maybe make more injury of the uterus. This instrument name is backhook. Backhook, why they are using? If the patient need tubectomy, if the patient is having 2 baby, 3 baby, they are planning for the tubectomy, that time they are using the backhook to hold the fallopian tube. Sponge holder, to cleaning purpose. Bowl, they are putting the betadine for the cleaning purpose. Outlet forceps, why they are using this one? If the baby is obstructed in the pelvic region, obstructed in the pelvic cavity, if they want to take manually, if the head is fully obstructed, the head is big, the pelvic is small, that means cephalopelvic disproportion, that time they are using the outlet forceps. This outlet forceps also, we have the two handle, left side and right side handle. How to differentiate means, if the blade is coming like this one we can use for the left hand. This is right hand blade. So we need to hold like this. So here also we have cephalic curve and pelvic curve. Inside is the cephalic curve, this one is the pelvic curve. So this is the outlet forceps. Mostly they are not using for the LSCS. For the normal delivery they are using outlet forceps. This is Doyne's retractor to retract the abdominal cavity. So the patient skin muscle is heavy. When you do retractor like this, they can see the uterus properly. Kidney tray. Why they are using the kidney tray? When they collect the placenta, they are putting inside the kidney tray. So for that purpose we are using the kidney tray.